Uh, Good evening, everybody. Let me introduce to our uh, guest today. Uh, the first is Dr. Gautam Saha. He's a very dynamic person. He is currently president of SARC Federation of Psychiatrists, and also he is also is an honorable president of Indian Association for Geriatric and Mental Health. He had been the past president of Indian Psychiatric Society, who has done his MD in psychiatry from University of Calcutta and also FRCP. He currently is into private practice and is a director of Clinic Brain Neuropsychiatric Institute and Research Center. He is also a member of World Psychiatric Association Standing Committee scientific session. He has authored 4 books and he is having many international, national scientific publications. Other than this, he is doing lots of social activity. And I think when we talk about hypnosis, I heard somewhere that Dr. Gautam Saha is having special feeling towards hypnosis. So probably he can be one of our guiding force as well as um, the activist also to popularize hypnosis. And we are thankful to Dr. Gautam Saha particularly because now he is in home with his broken leg. And still, despite having this kind of pain, he has agreed to join this program today, the launching program of Academy of Hypnosis. We are really grateful to you, sir.
Can I start?
No, sir. Just do it. We'll introduce Dr. Kalpana ma'am also.
Okay.
Dr. Kalpana Srivastava had been the immediate past president of Indian Association of Clinical Psychologists, and she is the president-elect of Association of Industrial Psychiatry of India. And her current position is she is Scientist J under Department of Psychiatry. It's a very senior scientist position under DRDO, Government of India. She is currently working at Armed Forces College, Pune. She did her MPhil in Medical and Social Psychology from Central Institute of Psychiatry and did her PhD under Ranchi University. She is recipient of Gayatri Gopal Award for Community Mental Health Initiatives in the year 2021 and also received Lifetime Achievement Award in 2018. She published around 160 scientific papers in various index and index journals. And for long years, she had been editor of the Journal of Industrial Psychiatry also. She completed more than 20 major research projects from DRDO, ICMR, as well as Ministry of Health. And she is being involved in collaborative project with Office of PSA Government of India on development of Manas app that is based on this digital media platform. We are really thankful to Kalpana Madam also, like after a single call only, she was ready to join this part of the initiative. Thank you, both the guest of honor. Thank you. Nidhi, over to Nidhi.
Yes, sir. Thank you, sir, for introducing us our chief guests. And I would now like to invite Dr. Gautam Saha to speak few words and declare the Foundation Day or Foundation Day ceremony as open.
Thank you so much. Respected Dr. Kalpana Srivastava, the past president of Indian Association of Clinical Psychologists, Dr. B.M. Palan, the president, Dr. Rakesh Jain, the vice president, distinguished guest speaker, Dr. Patrick McCarthy, and the president, Norwegian Society of the Hypnosis, and the president of Wellington, and also the Mark P. Jensen, the president, International Society of Hypnosis, Washington, and my dear brother, Dr. Prashant Ray, the senior consultant psychologist, all distinguished delegates, ladies and gentlemen. It is indeed a great honor for me to be invited as a guest of honor on the occasion of Foundation Day ceremony of the Academy of Hypnosis of India. I am especially grateful to Dr. B.M. Palan, the President, Dr. Rakesh Jain, Dr. Vice President, for extending an exceptionally warm invitation on this auspicious occasion. You know that already Dr. Palan described the history of hypnosis in India very elaborately. And if you see the history of hypnosis, dates back to late 18th century when the French Mesmer, a German physician, developed mesmerism, which is belief about the balance of magnetic power in our body. Using the animal magnetism actually. Though we know that later the concept of animal magnetism was rejected a decade later as it had no scientific basis as such. However, many clinicians are fascinated by the fact that the mesmer did cure many symptoms of the patient. One of the most notable clinicians that followed mesmer was Scottish ophthalmologist James Braid, who coined the word hypnosis, and it's originated from the Greek word for sleep. Modern science later provided the hypnosis was not related to sleep. But one of the hypnosis and sleep have in common is enhancement of our external focus. It is fascinating to know that in the mid-19th century, the Austrian physician Joseph Breuer's work got attention for the treatment of Anna, for the hysteria, and the Breuer used to suggestive hypnosis to trigger the Anna's childhood emotions, which resulted in the reduction of her symptom. The most prominent figure in the modern hypnosis is American psychiatrist Milton Erickson, who was a master of using language creatively in order to communicate with the patient's unconsciousness. That was unique in his approach and he was not interested in identifying the cause of the symptoms. Like many other clinicians back then, instead his focus was on helping patients release their symptoms by stopping the defense functions. He made outstanding clinical success, and his methods are called Ericksonian hypnosis, which was strongly embedded in other contemporary approaches such as neuro-linguistic programs. In our everyday understanding, we know hypnotherapy or hypnotic suggestion is a trance-like state in which one has heightened focus and concentration. It is usually done with the help of a therapist using verbal repetition and mental images. The aim is to make one feel calm and relaxed and more open to suggestion. We have seen many patients gain control over the undesired behavior or help us cope better with the anxiety and pain, especially in the conversion reaction patients. They are really get benefited out of this. In fact, in our early days practice, when I was PGTs, still I remember we called it ab reaction. We actually gave the diazepam injection very slowly IV and give them the suggestions, and also the elucidating the history from the unconscious mind was important. But my knowledge is really restricted to this field, and so let us hear from the international experts more on this subject. I am excited to learn from you all today. Thank you so much. Thank you, everyone.
So, ma'am, we would like to hear from you.
Yes, definitely.
Great honor to have you here. Please welcome.
Am I audible? Yes.
Yes,
thank you
ma'am.
very much. At the outset, I would really place on record the congratulations and very warm congratulations for starting the Academy of Hypnosis in India to Dr. Palan, who's the current president for the society, and Dr. Rakesh Jain, who's the vice president, and all the executive members of the foundation on this foundation day. It is really a pleasure to be here on this particular occasion, which is historical of nature, and also to see that the growth of the science taking shape in our own country in a way none other than taken initiative by Dr. Palan. I have a very nice memory of meeting Dr. Palan in the few years back. That I'll come up to the later. And I would also convey my regards to Dr. Saha, who was the past president of Indian Psychiatric Society, and as said by the anchor, he's a very dynamic person in his society in the mental health area, and he is very well known. Followed by that, we have international speakers, Dr. Patrick, Dr. Mark Jensen. So it is really an honor to be part of this platform. When I say about hypnosis in India, I just cannot ignore but to mention the Indian concept of hypnosis, that how it has been conceptualized by Indian literature. It has been told as Sammohan. I'm sure many of us must have read the Vedic literature, Vedic sciences. And we have heard about the Bhagavad Gita, the episode of where the Lord Krishna tries to really give a brief, people say cognitive therapy, psychotherapy, and when he gets very much disillusioned by the war. In fact, one of the interpretation of the journal they have talked about as part of hypnotic therapy, where the visual depiction of the whole scenario and the suggestion made him clear in terms of his process of thinking. So there's some thought process about the hypnosis and the practice of hypnosis. Moving onward from there, it has a legendary evidence-based practice in the surgical domain and the medical domain. What we needed actually was the evidence-based further work in this particular area and the practitioners who are there with the supervision and the training. I'm sure the Academy of Hypnosis in India will look into this, where we are providing the training and a supervision to take it further and to reach to the heights where we have the standards to match with the other countries in the world. Now we have a special mention, and one of the things I was reading to the mindfulness and the hypnosis, what is there which is common. So there's one where I came across a mindful hypnotherapy. And I really like the interpretation being offered there as mindfulness is awareness on the current, and hypnotherapy is being totally unaware of the peripheral things outside there. So it is also in a way facilitating the focus attention. So when you look at it, both are working on the dimensions where they are talking about the mindful hypnotherapy. So the scope is wide and varied apart from the conditions which are the mental health conditions and the living and the well-being, or across the various conditions which are psychosomatic or psychiatric and the medical. And really, this is a laudable effort by Dr. Palan and his team. And in fact, all of them are very well known to me, Dr. Prasanta, Dr. Rakesh Chan, and the people who are there, who are the facilitator for this program. I really feel honored to be here and congratulate, once again, I congratulate and thank you for giving this opportunity. Thank you.
Thank you, Dr. Kalpana. Your encouraging words are immensely useful for us. And sir, I would like to invite again Dr. Gautam Saha. Sir, if you're present here.
Yes.
Yeah. So please declare the
Yeah,
website of the Academy.
Thank you so much. I declare the Academy open, and also as well as the launching of the website. Thank you very much for this honor. Thank you all of you again.
Thank you, sir.